from the station that's on your side. This is Channel 7 News Daybreak.
The time now is 6:23. February is Heart Awareness Month, and Channel 7 is partnering with Baptist Health to give you an opportunity to ask your heart questions to Baptist Health physicians. Joining us this morning to explain and answer some of the more popular heart questions is Baptist Health's Dr. David Gerson with Sherwood Family Medical Center. Dr. Gerson, good morning.
Good morning.
Hey, thanks for coming in this morning. You even brought toys, I see. Yes.
Oh, yeah,
just a heart.
Believe it or not,
yes.
That's kind of what causes all the problems.
There you go. Yeah, right.
Yeah.
So it's of course central to everything. So let's get right to it. Popular ones. You'll probably get some of these as we have a call in later. But a popular heart question. All right, help me out with this. Atherosclerosis.
Atherosclerosis.
Athero. Okay.
Say that 10 times fast.
Yeah, right. So what is this?
So very simply, it's just basically, it describes how the thickening of the coronary arteries, a little hard to say on the model here, but the three main arteries that surround the heart, due to poor eating, smoking, which causes about 30% of all heart attacks, and just family history, we get buildup of plaque and fat. We get calcification of those plaques. They get brittle. It narrows the arteries. That's atherosclerosis. If the narrowing gets too much, it blocks off oxygen and causes what we call angina, chest pain with any kind of exertion. Sometimes, though, the things that are the most worrisome are when those plaques are real brittle. They don't even have to totally block the artery, but those plaques can break, and that can cause a sudden fatal heart attack.
Really?
And so that's atherosclerosis. That's our big enemy. That's what we're fighting.
Okay, link between smoking and heart disease. You mentioned smoking was a factor.
30% is directly related.
Okay.
And nicotine also in the cigarettes causes other things, and it blocks off the oxygen. It can cause clots. And so it also contributes to the instability of those plaques I was talking about in the heart. And so nicotine's, definitely a big enemy of our heart.
Let's talk about risk factors for coronary disease.
Sure.
Smoking, obviously.
Well, smoking, obesity, the ones that are really important, I mean, they're the controllable ones, which is what you're eating, obesity, diabetes, and the smoking, right? They're ones that you can't control so much, and it's you and me, we're being guys. Yeah. Our genetics, our family, you can't, you can pick your nose, I always say, you can pick your friends, but you can't pick your family.
Sure.
Nicer TV.
Yes.
Postmenopausal women. Women actually have a distinct advantage over men with heart disease, less heart disease until about 4 or 5 years after they become menopausal. And so that's something that they can't necessarily control. There's some debate still about it as far as hormone replacement therapy helping to avoid that. So that's something you have to talk to your doctor about. And then I think we said family history and genetics.
Now, speaking of men and women, the differences, what about symptoms and difference of symptoms?
Yeah, so women get the same symptoms as far as the chest pain and the jaw pain and the shortness of breath, but women can also be a little tricky in that they'll sometimes present atypically. So they'll present with nausea, they'll present with abdominal pain, they'll present with fatigue that they just can't explain. And so if they're things that just don't make sense and they're just kind of subtle symptoms, but you also have those risk factors as far as the family history and postmenopausal, we're going to want to work them up for heart disease, even if they're not having that classic chest pain.
Okay, the things that we typically see in movies and TV, other things that can, of course, be those triggers. Okay, a great opportunity tonight for you, our viewers.
Yep. That 324, I think that spells help, it's supposed to be, but there it is.
7888, yes,
yeah,
that's
we're
right.
going to have a bunch of cardiologists and cardiothoracic surgeons tonight on a phone line answering questions on Channel 7 tonight.
Looking forward to it. Thanks for coming in, taking a little time out this morning to answer some of the more popular ones. I'm sure we'll get some of those tonight, of course. Now, there's the number if you want to call the Baptist Health Line. You can do that anytime. That is 1-888-BAPTIST, or go to baptist-health.com.